Welcome to Protecting Joints and Preventing the Injury webinar. My name is Martha and I'm going to be your moderator. This is my first time doing this, so I'm a little bit nervous, but I think as I go along, I'll be just fine. I'm a JRA warrior. I was diagnosed with juvenile rheumatoid arthritis when I was 10. And after I got out of high school, I went to college to be an occupational therapist. And so I've been a practicing OT for 45 years. And I practice primarily in school-based. So tonight, we have several experts that are going to share important tips about protecting your joints during daily movement and exercise, as well as how to keep joints limber for better function. Before we get started, there are a few housekeeping notes about tonight's events that I'd like to share. First, we have muted all attendees for this event, but you can direct any questions you may have throughout the presentation in the Q&A box at the bottom of your screen. We'll reserve time to answer your questions at the end of our discussion. If you haven't already, please consider filling out the Arthritis Insights Assessment. It only takes about 10 minutes to complete, and doing so helps the foundation develop programs that speak to what's important to you. Obviously, you can do that after this presentation or at your convenience. And after tonight's session, you'll receive an email asking about your experience. These surveys help us track the success of these sessions and better plan for future events. So please take time to fill them out. Now let's start tonight by introducing tonight's panel. First, we have Dr. Alisa Curry. She is a board certified geriatric clinical specialist through the American Physical Therapy Association. She's an active member of APTA, where she is the chair of the Total Joint Replacement Special Interest Group, overseeing a network of rehab clinicians treating patients with total joint replacements. She's also the coordinator of rehab clinical programs at Washington Hospital Healthcare System in Fremont, California, which also includes rehab oversight of the Institute for Joint Restoration and Research. This program provides total joints for more than 2,000 patients per year. Welcome, Dr. Curry. Our next expert is Dr. Kaplan. She's an assistant professor of physical therapy and rehab science at the University of Maryland School of Medicine. Prior to joining the faculty at the University of Maryland, she co-treated the neuromusculoskeletal manual therapy program at Nova Southeastern University. There, she also served as a clinical mentor in the orthopedic residency programs and a clinical instructor for the acute care integrated clinical experience. Her clinical experience includes orthopedics, acute care, vestibular, and aquatic physical therapy. And our other expert is Dr. Ross. She's an OT. Dr. Ross is a clinical assistant professor of occupational therapy at the College of Nursing and Allied Health Sciences at Howard University. In addition to her role as clinical assistant professor, she has served as professor of practice at Howard University's College of Allied Health since 2009. She's also a certified hand therapist with over 20 years of experience working in hospitals and clinical settings, and the founder of Pinnacle Hand Therapy. Dr. Ross also has 15 years of experience as a certified lymphedema therapist, working with over 1,000 upper and lower extremity cases. So welcome, panelists. We're so glad to have you here. To kick off this discussion, let's start with some basics. How does arthritis affect mobility? And how does this differ from our weight-bearing joints, which would be like our knees, hips, ankles, versus our upper extremities, hands and shoulders. Dr. Curry, would you like to weigh in first?
Sure. I'm happy to join you. Hi, everyone. I'm Alisa Curry. I would say, everyone participating in this webinar today knows that uh, the impact of arthritis and any type of arthritis, because we know that there are a variety of components of arthritis, impact the joint by causing pressure, by causing pain, and the stiffness that's associated with it creates that secondary impact of a hindrance of your movement. So when you hurt, you don't want to move, and you know that you need to move, but you're impacted by that. So it's very important to understand that all of us are here today to help you realize that there are ways for you to maintain your function, to increase your mobility, increase your functional abilities. And while we understand that you will have pain, we want you to understand that there are varying degrees of it, and we want to figure out what's tolerable for each person to be able to enhance their quality of life.
Thank you. This is I'm going to throw this out for anybody. How does the impact of mobility contribute to injury risk?
I'll go ahead and start the ball on that one.
Okay.
So if in order to be injury-free, to maintain, to prevent injury, we need to have optimal strength in our muscles. We need to have optimal mobility. Now, we know that with arthritis come limitations in mobility and strength. So unfortunately, as our joints become stiffer, we lose motion, we are increasing pain, and we have some weakness associated with it. It does increase the risk for sustaining an injury. It's a little bit of a vicious cycle because all of those things lead up to the risk for injury, but then injury then causes all of those other things then yet again. So it's a little bit of a cycle there that sometimes is challenging to break because of the pain component.
Thank you. And I have a question for you, since you're one of our PTs. What is physical therapy? How can it help keep joints limber and protect against injury?
So physical therapy is really looking at how we move, right? Looking to optimize how we move to keep ourselves performing activities that improve our quality of life. So really we want to look and see how we can improve somebody's ability to perform the activities that are near and dear and important to them. So whether that is taking a walk, walking your dog, traveling to visit family members who live out of the area, it's really individualized for each person, because what's important to me may be different than what's important to you. So really honing in on how it is that you move, and then figuring out how that relates to your life and how to make that better for you as an individual.
Thank you. And Dr. Ross, can you briefly explain occupational therapy? I know it's hard to explain it briefly. I've been trying to do that for about 45 years. But explain occupational therapy and its role in arthritis mobility.
Absolutely. First of all, good evening to everyone, and thank you for having me. And thank you for that segue into occupational therapy. I will say that so frequently I will hear my patients referring to us as physical therapists. So what I would like to do is I would like to define occupational therapy by saying that we as occupational therapists seek the patient's occupation. And occupation doesn't necessarily mean that it's the job that you get up and you go to for for your day's work. It's anything that you need to participate in. You will often hear your occupational therapist speak of ADLs, which stands for Activities of Daily Living. When I came along, there were 3 areas that we looked at. We looked at a person's activities of daily living, which could deal with anything from dressing, bathing, instrumental activities of daily living, getting into the kitchen and preparing a meal. So where Dr. Kaplan will help you get to the kitchen, it's the occupational therapist that will help with the functional piece. The other pieces that we look at, depending upon where you are in your stage of life, will be either play for children. You talked about Martha having juvenile rheumatoid arthritis. So we would actually use play as a way of getting the goals met or helping our patients with meeting their goals. And then of course there's work. And then lastly, leisure, because having fun in life is just as important as getting up and going to work. So I would love for people that are questioning the difference between occupational therapy and physical therapy. And I think that the two actually almost merge together. But if Dr. Curry and Dr. Kaplan can get the patient there, OT can help them to gain their functional independence or as close to as possible. And as far as mobility goes, the structures that we typically work with as OTs deal more with the upper extremity. But at the same time, some functional tasks require you to use the whole body. And Martha, you said it was a long explanation, so I'm going to put a pin in it right there.
Okay, great. That was great, though. Thank you. The next section that we're going to talk about, we want to talk about easing pain with smart movement. So we're going to discuss the importance of proper form when using our arthritic joints. So I suspect we're going to be talking about positioning and things like that. So here's our first question. How does the way someone performs a task impact their mobility or set themselves up for injury? Dr. Curry?
Happy to take that. So a lot of what we do is as therapists, and I'm going to refer to us all as the rehab team. And the rehab team is occupational therapy, physical therapy, and the patient. We're all part of the team. So what we have to do is we have to figure out ways for people to move that allows them the freedom to function. And what that entails is I want you to think about putting on a shirt that's 2 sizes too small and how limited your function is when you try to do things. If we're talking about your hands, if you put on gloves that were tiny, tiny gloves, that would limit your ability to hold a cup or to reach for a door. If you put on, pants that were too tight, it would limit, it would limit your ability to get in and out of a chair or a theater seat or a car. And so what we all are trying to do is to eliminate the restrictions. So a lot of our focus and mobility is around flexibility, which is a key component in maintaining function, about stretching and about range of motion, because you have to have the range of motion to then be able to move. And then from there, we can start to get people more comfortable. A lot of the limitations in movement come in fear of what might happen, fear in if I do this, I might fall. If I do this, I might not be able to recover. And so you start to limit your functional abilities in life, and that's what we're shooting for, is not to limit yourself.
Thank you. Dr. Ross, can you give us some tips on the best way to perform some of these common functions? And I'm going to give you a list, and I'll have you go over them maybe one at a time. So we're going to start with lifting. Can you give us some tips on the best way to perform lifting?
Well, it depends on what it is you need to lift and where you need to do the lifting. And then, of course, we'll talk about how to do the lifting. And I say all those things because that goes back to us making the patient an individual. And I say those things because I think that they actually segue into what we do as therapists with our educational piece. So where is it? The patient with the therapist should plan. So say, for example, if you need to lift something heavy, which I would suggest you try not to do, you don't want that heavy item to be very high. you want to plan to have it at a space that you can very easily get to it. And then you want to make sure that that lifting occurs close to your body. And there does come a time during during the process of arthritis, that there's certain things that you shouldn't do. And you should plan to have assistance with that. Now, say, for example, if you're in a kitchen and you're cooking and you're still doing pretty good, you can look to situate yourself so that you actually have pots and pans that maybe have more than one handle, so that you're not only using one hand, you're using two hands and using oven mitts. One of the other things that I encourage, if I saw Dr. Curry bring something to her mouth, she was drinking something. One of the things that we also encourage is using two hands. But with this, notice I'm saying keep using your joints because it's important. So you want to begin the process of lifting by planning and organizing, and then sometimes delegating.
Excellent. Excellent. And how about reaching?
Yeah.
Tips on the best way to perform reaching.
Yeah, and I think I kind of
You did,
sort
yeah.
of segued into that, but let me say something else about that. You know, occupational therapists have assistive devices called reachers. And I want to say, because this is about joint mobility, and I want to encourage our audience to plan and organize and put things where you can comfortably get to them. Because one of the things that we do not want to do is we don't want to advocate for us positioning ourselves where we begin to lose mobility. So I believe that we have to be very purposeful in choosing where we locate things. There may come a time where if you have a dresser drawer, you may actually want to put things in the middle of that dresser so that you don't have to always bend down, or you're not going up too high, but at the same time, all of that motion is important for keeping our joints limber.
Awesome. This is really good stuff. And the last area is grasping, gripping, and opening. I know that's a big one for people with arthritis.
Yes, and Martha, you're going to have to cut me off because as a hand therapist, you are talking my language now. I cannot stress this enough, and I know that my PT team will continue to bring this home. But again, it's so important that we use our hands. What do? We do recommend such things as if you're having stiffness and pain in the morning or in the middle of the night when we sometimes have to get up to go to the bathroom, that you may want to consider something like an isotoner glove to keep the joints warm so that you can actually move them. And I might be going into another segment, so I apologize for that. The other thing that you can consider doing, the word ergonomic is out there. And what that simply means is it means making handles a little bit larger so that you're not doing this, but you're doing this. You can do things now like go to the hardware store, because we talk about aging in place, and maybe change your doorknobs so that you're not doing this, but you have a lever. And the big thing on that from a hand therapist perspective in arthritis is using your larger joint muscles. We hold our purses like this, our briefcases, and we talk about all the time putting them on your forearm, using your elbow muscles. And I could go on and on, but I do want to put one plug in. There is something that's called a dexterity kit, and dexterity kits are actually necessary for building up pencils, adding leverage to keys. It's phenomenal. And then the other thing, if you go to the Home Depot or to the Lowe's and you go in the plumbing section, you can get those that piping that you put around electrical equipment, or when it's pool season, you can get those floaters, and you can actually put those on handles so that you can actually increase your grip.
Excellent. Yes.
Okay.
Yes. Thank you. And
Martha,
what about?
I'm going to add one thing.
Okay.
You made a comment about lifting and bending and reaching, and I just want to emphasize to everyone that if you are asking the question, "Am I safe to do something?" there's adaptable ways. And so the key things that I think people always want to develop is a list of the things that you're having problems with, so that you can give your therapy team a list of things to tackle. because every activity can be broken down, just like Dr. Ross talked about. Everything can be broken down to figure out how do we make this easier. So, when you talk about how do you reach for something, reaching involves getting off of your base of support. And if you don't have good adaptable techniques to manage that, you have to manage it with strength, as Kelby talked about, or you have to manage it with adaptable tools. So there's many things that we as therapists can do. We just need to know what the punch list is of things that you want to be able to do.
That's great. And I wanted to put in a little bit about some resources. So maybe not all of us can go to OT or PT right away, but another resource is that the Arthritis Foundation, they have an online community forum, and there's lots of different, I think they're kind of like rooms, but they're just kind of themes. And one of those themes is body posture and joint protection, where you can talk about maybe your specific situation. And obviously you're not going to get, medical advice from there, but there's lots of other people with arthritis that have kind of been through it. So it's a wonderful resource for you to check out. So it's the online community forum, Arthritis Foundation, the Arthritis Foundation. Okay. All right. So this question is for Dr. Curry. What about the best way to walk or climb stairs?
So walking and climbing stairs, the main thing that you want to know is that you have an equal stride length. That means your steps are equally placed. If you find that you are unable to balance, unable to walk without fear of loss of balance, if your momentum is such that you get off of your base of support, that's when you want to add in an assistive device. It's easiest to add in a cane, and I know that vanity sometimes gets the best of us, and I want to emphasize that assistive devices are there to keep us independent, not make us dependent. So we're trying to help people maintain their independence. So if you become more independent with a walking stick, or you become more independent with a single point cane or a hurricane or a narrow based 4-point cane, those are things that help to keep you independent. Don't be afraid to establish a wider base of support. I'm going to turn it over to my fellow PT because I know she's got some input on this. So go ahead, Kelby.
Thank you. So I agree, and I echo those sentiments. Other suggestions for going up and down stairs, most people have actually figured out as they have been managing their condition and managing their pain. One phrase, if you've ever had PT, our typical phrase is up with the stronger leg and down with the, right, up with the good. I hate to say that, right? And down with the bad. I don't necessarily want to call limbs good and bad, but we'll just say up with the stronger leg and down with the weaker leg, because that allows you to use the muscles that you have that are stronger, perhaps that are less painful, in a way that helps you get up and down the stairs faster and more efficiently and safer, right? Bottom line, we need to get you up and down the stairs in a safe manner. So use handrails if they're there. Okay, they're there for you to help with the balance. So one handrail, two handrails, certainly feel comfortable using those. And if you find that you're having difficulty with one particular extremity that is more painful or weaker, then go one step at a time and get yourself up safely, rather than going one step over the other. Sorry for my little visuals there. But it's safer and it may be less painful. And so remember, there's a life at the top of the stairs. So you don't want to be in so much pain that when you get up to the top of the stairs, you're not able to do whatever it was that brought you up the stairs to start with. So that's one thing that may help, is just slowing down a little bit and using your stronger limb to help propel you up.
That's great. If I can share just a real quick little personal experience of mine, as I've aged with arthritis, I noticed that I was having balance issues. And so, and with my joint replacements, throughout the years, I did use canes, I've used crutches, I've used a wheelchair, I've used all the different mobility devices. But the one thing that I chose to do was to get a mobility service dog. And the reason I did that was because for me, I had a lot of anxiety, especially like when I'm in a crowd, so that even if I were had a cane, my fear was always that someone might run into me and I would fall down. So I have a very high anxiety level for fear of falling, which I think may be pretty typical. So having this great big dog next to me walking kind of encourages the John Q public to give me a little more personal space. And then she also works to help me pick things up. I can use her to stabilize if I have to, get something on the floor or go from on the floor to standing up. So that's not really probably something that is for everyone, but I have found her. I've had her for 4 years now. My dog, her name is Allie, and she's an amazing partner.
Yeah, and that's exactly what a cane is, or a
Mhm,
crutch, or
mhm.
a walker. It's a visual cue to the average person that you're not 100% steady on your feet. So
Yeah.
those are things that absolutely, whether it's a four-legged friend or a single point friend, those are key.
Yes. So I need to mention that the Arthritis Foundation has a Walk with Ease program. It's a 6-week guided program for anyone who is struggling with walking. And you can find more information at arthritis.org/walkwithEase. Okay. And then what about pushing and pulling? Anyone? Anyone ever?
Actually, I'm gonna jump in there. That typically goes to my PT colleagues. But I liked what you said about positioning, Martha. I think creating a wide base of support. One of the things that I have to often say to patients is don't make a fist. For some reason, people want to make a fist and push up off of their small muscles. So what I say is get a wide base of support. What that means is sort of spread your feet apart so that they're at least shoulder length apart as you come to the edge of your chair, and then use the palms of your hands to push up. And then from another therapeutic occupational upper extremity vantage point is closing and opening windows. Using your whole hand and not just your fingers. I said this before, a lot of fancy drawers and dressers, they have little knobs and little places. If you have to bend the fingers to open them, use your hips to push it back, so that you can actually save. So pushing and pulling, that's going to be my ad there.
Mm-hmm.
And as well as lower extremity, I would say, when you're pushing and pulling things, it's easier to push than it is to pull.
Mhm.
When you pull, you have to have balance, you have to have control. And when you push, don't be in a hurry. Don't try to do it in one quick shove, because if something moves faster than you think it will, then it can take you and that object over. So always think about trying to move things a small amount first. Don't try to get it in one quick shove. Try to always do things with control and have a plan, as to how far you're going to move it. The number one thing is, don't be afraid to ask for help.
Hmm.
You have to be willing to ask for the help.
Okay. Dr. Kaplan, can you show us the proper alignment when standing or sitting in a dining or an office chair?
Proper alignment. Okay.
Proper
So-
alignment when
Sure.
you're sitting.
So don't mind me as I adjust my screen here. So ideally, I don't know if you can actually, woo, I'm too far. There we go. So ideally, your feet should be flat on the ground, should be supported. If you're sitting in a chair that's too high, make sure that your feet are not dangling, okay? So if it's a step stool underneath you, a book, anything underneath so that your feet are supported, that will provide the most stability for your hips and for your lower back. So ideally, we would want a 90-degree angle. So I want the knees to be around 90 degrees and I want the hips to be around 90 degrees. Now, when you're sitting in a chair, remember that your back is not flat. It's not meant to be straight up and down. There are normal curves of the spine, and we want to maintain the normal curves. So you'll notice most of your chairs have a little bit of lumbar support. Okay. And if your chair doesn't, and it's actually straight, then you can roll a hand towel, something small, to put by the belt line to maintain that normal curvature of the spine. Okay. A normal seated posture isn't always directly straight with your shoulders straight back and overemphasized. It does sort of respect the normal curvature there. But I would highly recommend that you scoot your bottom back in the chair so that you are supported. Okay, if that means that you have to, that your feet are dangling, like I said earlier, make sure it's supported. But you want to be seated all the way back and resting on the back of the chair so that you're not overusing your spinal muscles, because eventually they'll be fatigued, and then that could be a potential source of pain while you're sitting for a long period of time. You want to be conscious that you are not rounding your shoulders forward and doing this with your forward head, which many of us do when we look at our cell phones, we look at our laptops. So whatever it is that you're looking at, whether it's a screen or a television, you want to have that up at eye level, and that will help you to avoid that rounded shoulders, forward head posture that can very often cause a lot of pain when we do a lot of sitting. So those are just a few suggestions from a posture standpoint. Typically, office chairs or dining chairs are the most supportive, as opposed to a couch or sofa. Things that are a little bit firmer tend to be a little bit more comfortable and a little bit more supportive. So if you have arthritis is affecting your hips, spine, neck, shoulders, you may find that you're in fact more comfortable even watching TV in a firmer chair than you are sitting on the couch.
Awesome. Thank you. Let's talk a little bit about hazards around the home, maybe, and or when you're out and about. What are some things to look out for to prevent injury, or how do you get around them? And this is for anyone.
I'll go ahead and start this one off. So, in looking at your environment, the main thing that you want to be aware of is what are the obstacles? What do you have to clear to move around in your environment? Many people don't think about it, but the closer that your furniture sits together, if you've got to change your body position to move past something, then you don't have enough space. And many things, we hang on to for sentimental reasons. I'm in this situation right now. I have a couch that's probably a little too big for the space I can walk through, but I brush the sides of the chair and the couch that sit close to one another. And, for someone who doesn't have any sort of physical limitations, that is not impactful. But as you have to be more aware of your body movements, and as you have to be more aware of things that might throw you off balance, you want to reevaluate your space. How much do you have to pick up your feet? Do you have carpeting that you catch your foot on? Do you have difficulty lifting your feet up to clear, and do you find yourself stumbling or tripping? Your footwear, is it time for a new pair of slippers, and is it time for a pair of slippers that slips completely on your foot as opposed to, something that's open in the back? So you just have to be honest with yourself about, is it time to make a change so that you've taken away obstacles? So whether you have to walk around it, whether you have to step over it, or whether you have to move through it, those are the things you want to take a look at.
Excellent. I just want to also mention rugs around the house, cords, uneven sidewalks, those kinds of things can be trip hazards also.
Yes,
Okay.
rugs can be taped down. Sometimes they do cover something important, and so they can be adhered down. That's what's great about places like Home Depot and other home improvement stores is you can get stuff to adhere things down as opposed to taking them away completely.
Okay.
One thing, oh, I was just going to add to that. When we're in our home environment, we feel fairly comfortable, right? We know where things are. But when we go out in the community, that's really, I think, where the risk comes. And this has been mentioned earlier, talking about preparation. Well, one of the ways that you can prepare when you're out in the community is by scanning your environment. So when you're standing and you're walking in a store, if you're in Target or Walmart, you don't want to be looking down. Of course, that would end up causing some potential neck and shoulder pain as well. You want to have your head looking up, and you're looking and scanning the floor about 20 or 30 feet in front of you so that you can still maintain your upright posture, but you see what's coming towards you at about 20 or 30 feet away. You can look at the floor, see if there's something there that has fallen. If you're walking outside, you would see a crack in the sidewalk potentially, or a raise in the sidewalk before it comes upon you. So being aware of the environment as it's around you before you end up walking and looking straight down, because that in and of itself becomes a fall risk. You won't see a person coming towards you. And if they're not paying attention where they're going, you want to see them before they bump into you. So when we're out and about and that environment's a little bit more unpredictable, scanning, just getting a lay of the land may help prevent you from getting bumped into or losing your balance or tripping over an obstacle.
Right. And I'm going to add one more thing to exactly what Dr. Kaplan said. This is especially important as we get into the holiday season. There's many people who don't leave their homes because they're afraid to get out in the environment or they're limited. Except during the holiday season, people feel the need to be more active. They go to unfamiliar homes or homes that they're not around very much. They're walking more than they maybe do normally, and they fatigue a lot easier. And when you're in an environment, just like Dr. Kaplan stated, that's unfamiliar, there's different hazards to be aware of that you may not be aware of. So during these times, that's even more important to do exactly what you stated, which is to scan your environment, to have a plan, take your time, and especially, if it's not familiar to you, ask for help so that people can be of assistance.
Awesome. We're going to move on if that's okay with everybody. Yeah. Okay. We're going to move on to strengthening joints to preserve our mobility. Why is it so important for joint protection, mobility, and injury prevention? So why is strength training so important for joint protection, mobility, and injury prevention? Dr. Curry?
To start with, I'm sure both Dr. Ross and Dr. Kaplan will have input on this. You have to have range of motion to be able to make muscles stronger. You can strengthen your muscles, but if your overall flexibility is limited, then what happens is you are only strengthening a small fraction of the total available muscle. The greatest news to a patient with arthritis is that muscle will always remember how to stretch. So no matter how much range of motion you lose with the impact of arthritis, muscle can always be taught to stretch. So you don't have to start flexible, but you can improve your flexibility over time. So the more muscle you make flexible and you increase the elongation of that muscle, the more muscle you have to strengthen. I'll stop there and I'm going to turn it over to my colleagues here.
I will add to what Dr. Curry said, and I say this often to help my patients, is that if you think about a muscle has a tendon that connects soft tissue to a joint. Every joint that tendon crosses, it moves. And we are just wonderfully made, which means that in some cases we have more than one muscle that actually that will move a joint. So when we lose the opportunity to have strength in one area, we have another muscle that will kind of pick up and do what's necessary. And if you don't mind, very quickly, I just want to talk a little bit about osteoarthritis. I see a lot of joint arthroplasties for the thumb. And I remember when I first started as a therapist, they were doing them similarly to how they do hip and knee replacements. And they learned very quickly that the material that they were using to replace the joint, it's a small joint just at the base of the thumb, they would actually take the bone out because the cartilage was being lost. Now what they do is there are actually two muscle in the hand that start in the arm, that end in the hand, that the surgeons can extract that tendon and use that to replace the bone, so that your body doesn't reject it. And I say that to say this, that means that without any surgery, you have extra sources of muscle for strengthening. Dr. Kaplan, it's your turn if you want to jump in on this.
Sure. I'll take the other end of the spectrum and talk a little bit about rheumatoid arthritis. So as you mentioned, artfully, we are beautifully made. And so we have a lot of structures in our body that help to maintain joint stability and also joint mobility. So in addition to tendons that cross joints, we have ligaments, we have capsules, which are sort of like saran wrap that surround all of our joints to keep everything stable. And unfortunately, when in the situation where you have rheumatoid arthritis, those tissues aren't doing their job at this point anymore. They're not always keeping you as stable. But by strengthening the muscles that surround the joint, we're able to account for the injury and the breakdown in the ligaments and the joint capsules and all of those other tissues. So we can sort of accommodate for some of the things that happen as diseases progress. So in addition to all the other reasons that my colleagues have shared, it's another little mechanism, a bonus that we can do to help counteract the anatomical structures that are there to keep us stable.
Awesome. Let's talk a little about maybe some exercises that we can do to strengthen our joints. So let's start with our upper body joints, our shoulders and elbows, which we know are important for reaching, lifting, pulling, and pushing. Could one of you share some exercises that would be helpful to maintain or strengthen these joints?
Good.
Do you want to start, Dr. Curry?
Actually, go ahead, Dr. Russell. I'm gonna let you talk about the upper extremity.
Okay, well, one of my favorite joints are what we call tendon gliding exercises. And what tendon gliding exercises are, and I'm just going to actually show your audience. You start with your hand in this position. It's totally straight. That is an exercise because most of the resting position is at about this place. So if you drop your hand down by your chair, you would see that your hand is slightly bent. So to ask someone to do this is an exercise. And then what we do is we go into bending the middle joint and the tip joint as much as you can. And a lot of times, even with arthritis, one side of the hand is affected more than the other side. So you can always compare and contrast that I have a little bit more on one side versus the other. And then what we do is we go back to this position, and then we go into what I call the tabletop. And even I have to get some help there. But I'm just bending just this middle part of my joint here. And we hold that. And I should say with these exercises that you should not do them quickly. You should actually hold them for at least 5 seconds and then go into the subsequent ones. And then I usually go back to this, what I call neutral position. And then I go down to what I call a straight fist, where I'm taking the tips of my fingers and trying to touch the base of my palm. Okay. And then after that, I'm going back. And I always say the goal is always to be able to make a full fist, even though you don't want to always use your full fist in arthritis. So I ask my patients to go to a hook fist and then curl in to make a full fist. That is one of the exercises that we do a lot of. we actually measure every joint. So wherever we see a deficit, we try to set up a home exercise program. That is our primary one for the smaller digits. One specifically for the thumb, we have 1, 2, and then 3 joints in the thumb. So we isolate each one of them so that we actually get motion. And then of course there are 6 different motions that we do at the wrist. And then the only other thing before I turn it over to Dr. Curry is that I'm a strong believer that strengthening is good because we want to make our muscles strong, but we don't have to work at our absolute max. I think that what we need to do is we need to do less than what we can tolerate, and then kind of work up so that we have oh, what is the word that I'm looking for? Endurance, because you want to increase your endurance. And then I'm going to add one last thing, and that's this, because I find this with a lot of patients. They don't understand when to use ice versus when to use heat. And I always tell my patients that if you've done something around those joints and they're angry at you, you probably need to use ice. But if you're at a place where you've been sitting for a very long time and the joints just feel like they're stiff and they can't move, then you need to use some form of heat. And you want to be careful about how you use heat and how you use ice. I always like a cloth over the skin with my ice. I typically don't do ice more than 8 to 10 minutes. And I usually say after 20 minutes, there's no significant value of the heat. You might want to take it off and probably do some exercises, because what that heat does is it brings more blood flow to the area. It actually gives you the opportunity to have what I call joint extensibility. And that's just a fancy way of saying it allows the joints to move further.
Mhm.
Okay.
Awesome.
Absolutely.
Dr. Kaplan, Dr. Kaplan, do you have anything else to add, or can we go to the lower extremities for strengthening?
I was going to say, I'll defer to Dr. Curry because I know that she had some good information that she wanted to share. So I'll let her go ahead.
Okay,
I-
thank you.
No, and feel free, Dr. Kaplan, to hop in here. I am just sharing my screen, but I have recently done several fall prevention and fall recovery sessions, and so if you can see my screen, these are just a quick list of things that you can do for the lower extremity. Single limb stance is something, I highly recommend that people do their exercises in their kitchen, because the kitchen counter is a great place to rest. If you have an island in your kitchen as well, or a butcher block, you can always stand between the kitchen counter and an island. You can always stand at the L intersection of your kitchen because it gives you something to hold on to. But lower extremity exercises and upper extremity exercises, the thing that everyone should remember is that it's the trying that's your exercise. If you are making an attempt at it, you are exercising. And so I don't want anybody to negate that they're not exercising. You are exercising. If you park your car 2 more spaces than you'd like to so that you can walk a little bit farther to get to and from the store, that's exercise. And so brushing your teeth, you can stand at the sink in the kitchen on one leg and brush your teeth, and that is single leg stance training. If you want to brush your teeth with one hand and hold your other arm above your head, that is training for that is challenging you. Anything that challenges you is going to help you to get stronger. One of my favorite exercises to have people work on, believe it or not, is getting up and down from the floor, because getting up and down from the floor takes the range of motion of being able to bend your knees, to be able to bend your hips, to be able to lower yourself down and get all the way down to the floor, not just a little bit and back up, but lay down in the floor. Be there in that for a minute, because that is one of the biggest fears that I talk to people about, because they have huge fears that if they get down there, they're not going to be able to get back up. And so getting yourself down to the floor in a controlled fashion takes away that fear. My mother-in-law had I'm going to throw this out here. My mother-in-law had major neck surgery about 2 years ago, and she recently was sitting in a chair outside, and the chair collapsed underneath her. And that is people's biggest fear. is that they're outside with nothing to grab hold of and they fall and they can't get up. She popped right back up, she told me, because this is something we talked about, we talked through, we worked on, and she felt so confident about it that she got herself up before she knew it. And so it's the practice that gets you comfortable. And so if you do it in a controlled environment, if you start with basic things like your body, using your body weight, so you can start with things like wall push-ups where you're upright and you're just pushing back and forth away from the wall, depending on your arms. You can then start to move your feet further away. You can move from the wall to a countertop and doing push-ups on the countertop if you can tolerate that. You can do marching in place. You can stand on your tiptoes. You can stand on your heels. These are all things that challenge you. And as I said, the more that you challenge yourself in the things that make you try harder, that is your exercise plan.
Awesome. All right. Let's move on and let's talk a little bit about protecting our joints during movement and exercise. What are some maybe assistive devices you would recommend for higher intensity workouts like running or aerobics? And this is for any of our panelists.
So I'll jump in. I'll start with some easy ones. So exercise resistance bands, I think, are great. You can start with what's called TheraBand. These are stretch bands. They also make what's called a TheraLoop, which I love. It's just a looped band. It can be hooked around a door handle. It can be hooked around a chair leg. And you can certainly do this with TheraBand, which is stretchy elastic band. They come with handles, so you can use that as well. If you can't go out and purchase exercise equipment, my favorite pieces of exercise equipment are a gallon of milk, because as my occupational therapist friends know, a gallon of milk weighs 8.8 pounds. So you can certainly start with that. You can start with a can of soup. You can start with a bag of beans. If you have it in the cupboard, you have exercise equipment. The other thing is you can also do a broom, and you can do wand exercises with a broom. I talked about some wand balancing, and you can do things like tape your bag of beans. If it's centered, it's going to have more balance, and the more that you move things out to the ends, it becomes more weighted equipment. So if you've got masking tape and you've got two bags of beans, you've got yourself a push-up bar. So there's plenty of things to be built.
Awesome. And what about joint protection tips and assistive devices for exercises that require a lot of hand use, like yoga or weightlifting and rowing? Dr. Ross?
Yeah, actually, I like what Dr. Carey said there about, how to make
Yeah.
weights from the house.
Yeah.
Everybody always has too many bags that they go to the grocery store with. Everybody's trying to, cut back on getting that plastic or so forth. But, I mentioned this earlier, but if you get one of those tubes that you float on in the swimming pool, you can actually have someone cut that, or you cut it yourself, and you could actually put it on the bag handles, and you can actually do weights with that. As far as any of the other activities, I think water aerobics is wonderful for arthritis, because it eliminates the gravity. It takes the resistance off of the actual joint. And I know that a lot of folk will go to water aerobics for their lower body, but once you put your elbows and your hands in the water, oh, it's wonderful. So I'm a big proponent of that. And then as far as yoga, I'm going to say, wherever you go, make sure that whoever your instructor is for yoga has a license, and they understand that you are dealing with arthritic joints. And then one of the things that they will help you with is posture and positioning. And then, of course, there are sometimes braces or gloves that will support your metacarpal joints. and your wrists, so that when you're doing specific motions, you have that support.
Awesome.
Dr.
Any,
I'm sorry, Dr.
Go ahead.
Kaplan, do you have something?
Just going off of what Dr. Ross had said, I'm a big proponent of group fitness classes for a lot of reasons. I think there's something to be said for the mental component of exercise, certainly for all of us, for
Absolutely.
stress relief, the camaraderie. We're just coming off a pandemic where so many of us were isolated. So I'm a big proponent of group fitness. And I do think it's incredibly important to let your instructor know, and you don't have to divulge certainly anything you don't feel comfortable sharing. But I think if you have some physical limitations that you want to share because you want the feedback, you want to make sure you're doing the exercises properly, let them know in advance, not after the fact, that, hey, this is, I have some arthritis in my knee, or I'm really trying to push off, trying to have my hip replaced or whatever it is. Then you can share that with them, and then they're keyed in so that they can give you the proper feedback, because you don't want to not share and do an exercise perhaps that isn't using proper form or that isn't safe for you. So understanding, sharing that with the group fitness instructor. A lot of them have a lot of expertise. They've undergone a lot of training. Some of them my sister's a physical therapist. She's also a fitness instructor. So you might get lucky and hit the jackpot with somebody who has a history and experience like that, but you definitely want to let them know so that they can help you. I think there's a lot of advantages to being in a room exercising with folks that are like-minded.
And
Awesome.
and to add to that, I would say the biggest factor that takes people away from exercise is how they feel after they exercise. So you do exercise, you take a great, water aerobics class, you take a great group fitness class, and then the next day you're completely sore, you're achy, you can't move, you're stiff. Don't be afraid of that. Your body has delayed onset muscle soreness. You are changing how your muscles react. And so don't be afraid that you have more pain after you exercise. It's not, it doesn't mean that you can't exercise. It just means that you've challenged yourself. So don't be fearful that you're going to completely damage the joint by exercising, because you're not damaging the joint. You are challenging the joint, you're challenging the muscles around the joint, and you have to learn how your body responds. So I always have people say, okay, the next day I was extremely sore. Let's take a break. Let's do some icing or some heat and some stretching. Let's see how I feel the next day. It may take you 2 or 3 days to recover from that, and it's okay. But as long as you find yourself getting a little better and a little better and a little better each day, you know that you're on the right track, so that you can go back and maybe the next time do less, but you're still doing it.
Mhm.
There's a big difference between hurt and harm. And I think that's something that we're afraid of. We don't want to do something to harm ourselves, but you want to think about, okay, my muscles may hurt tomorrow, but is that really harmful for my joints? Muscles hurting after exercise. And I think most of us can tell the difference. Muscles hurting when you've specifically done something to work them in a new way is to be expected. So understand that that doesn't necessarily mean you harmed yourself. So that's, especially since that's something we're really all concerned about and fearful of. So just have that mindset of, I may hurt tomorrow. My muscles may hurt when I go to sit down on the toilet, but I didn't harm myself. And like you said, if you're continuing to improve, it's those muscles adapting and accommodating for it. But that doesn't necessarily mean you did something harmful for yourself.
That's right. Seeing a PT or an OT for a starter exercise program and follow up is the best way to get that guidance.
And if I could share just a little bit about a personal experience. So when I was diagnosed, there weren't a lot of the wonderful medications that there are nowadays to quiet the joints and prevent the injury. So I got the full gamut of injury. And of course, I have had joint replacements. And so I found that for me, sometimes going to the classes, I was so limited that I felt like I couldn't participate fully. And so being an OT and trying to be a resourceful warrior, I've always tried to figure out, so what can I do? If I can't do that, let's find something I can. And my most recent thing is, because sports for me is very limited. I'm not able to ride a bike. I can't jog. I can't go hiking. But I found an adaptive sports program where they did summer water sports. And so it's a nonprofit, and it's actually a very, very specific on the lake. And so I did adaptive water skiing, tubing, and kayaking. And so you might want to look around your area and also consider that if you're at that place where maybe you can't do things in a typical way. The other thing that I do is adaptive riding, so adaptive horse riding. And I've been riding for about 3 years now. It's made a huge improvement, actually on my balance skill because my core is stronger. And so those are just some kind of maybe alternative things that some of you might want to consider if you're at that place where maybe some of the traditional exercise programs or whatever might not feel comfortable for you. Okay. Okay. Let me see if we have any more questions. You know what? You covered a lot. I think maybe we can go to, well, first of all, do any of you have any other thing that you want to share before we go to question and answer?
I'll start with a couple things I want to talk about. Just the fact that we are definitely talking about protecting your joints and things that you can do that you have control over, having an exercise program and things like that. The first thing I want to talk about is that you can certainly speak to if you feel like you're trying these things and they're not working. Please make sure that you're communicating with your physicians, especially about what your options are. I have worked in the field of total joint replacement for the last 26 years, and we in our program we do a lot of emphasis on once people have the joint replacement, getting back to a lifestyle where they have complete function. So, that may be an option for you, but the best discussion is to have with your physicians about, about what kind of limitations you're suffering from and options that are out there. So I would just, make sure I would be remiss if I don't discuss that because I know that it does work and I know that people can have really great outcomes from it. The second thing I want to just remind people of is don't accept that your life space has to be limited. There's a great assessment tool that was put out by the University of Alabama, and it's a life space assessment, and it just talks about assessing, when's the last time you left your room? When's the last time you left your house? When's the last time you left your neighborhood? When's the last time you left your city? And when's the last time you left your state? And if your life space is getting smaller and smaller and smaller, that's one of the reasons the Arthritis Foundation is here. So you want to make sure that you're keeping track and it's not just this insidious loss of the things that you want to do in life. There's ways to stay active and there's ways to be functional, and that's why I think all of us are here today, is just to make sure that everyone knows that.
Okay, anyone else? Okay, if not, we'll go to, oops, go ahead.
Go ahead. I think we probably will get it in question and answer.
Okay. So one of the questions is, for someone new to physical therapy or exercise, about how many times a week should someone aim for, and for how long? I know some of you have mentioned that, but if we could go over that again.
I will start, Martha, with that because I think that was going to kind of segue into what I wanted to kind of bring to the forefront. It depends on why you're coming to therapy as a hand therapist. If you're just coming under what I call conservative measures, and that is because you realize that you have pain and we need to work on exercises and mobility and strengthening. Typically, we can see that patient once a week or twice a week and still meet our goals. Now, I heard you say that in your earlier years, you had some joint replacements, and there are joints that are replaced that are secondary to rheumatoid arthritis in the hand. And as a result of that, there's a typical protocol that needs to be followed. I will see the patient once the bandages come off after surgery, and we guide them through. And one of the things that we're looking to do, especially with rheumatoid arthritis, if they have limitations in the joints, and I have a little show and tell here, we typically will put someone in a thermoplastic splint that we actually form in the clinic. And the other thing that I was going to say that I want to just bring into that is there was a question, I believe, about should you wear the splint all the time? And what I've started doing is I have some patients that will wear this splint with some activities such as gardening, and then wear this splint to warm the joint. This is actually a neoprene splint. It has rubber between material. Doesn't have to look like this. Just remember the word neoprene. And what it does is it warms the joint. In many cases, they are very functional, and they do help with warming the joints for driving.
Awesome. Those who have joined us, I wanted to let you know that you can type any question you may have in the Q&A chat function at the bottom of your screen, and we'll try to get through as many questions as we can with the time that we have left. If we don't get your question, there is a helpline, and I will give you more information about that later. Okay. Another question from the chat is for Dr. Ross. Where can someone find a dexterity kit?
That's a very good question. I purposefully said dexterity kit because if you Google it, there will be opportunities and options for it. If you are in therapy and you ask your therapist about it, some therapists, I don't know if they still do it. I used to get functional solution catalogs, and those are catalogs that we're able to give to the patient. And you actually can go through the catalog, and it actually shows you a lot of adaptive equipment. But a dexterity kit is that's exactly what it's called. If you Google it, you can get it from probably Amazon, quite honestly. And the kit is going to actually have several things in it. It might even have what we call a button hook. So when your fingers are at a place where you're having difficulty buttoning small buttons, there's actually a device that actually helps you to grab a hold of the button so that you can lead it through. It will include a buildup for any normal size pen or pencil. And it will actually give you sometimes caps that will help you with opening medicine bottles. So there are a variety. So it depends on what type of dexterity you need assistance with.
Okay, next question. What are some do's and don'ts to keep in mind when looking for an arthritis-friendly shoe?
I'll start the ball with this one. So the biggest, there isn't one shoe that's appropriate for every foot. Okay, so let's just start by saying that, right? Feet come in all different shapes and sizes. But one thing we want to be mindful of is that whatever the shoe is you're wearing, that your foot is inside the shoe for good. Meaning a slide, okay? We love flip-flops, we love slides, slippers. Those are really a little bit of a risk and not particularly supportive. And because your foot is not stable in the shoe, it actually becomes a little bit of a fall hazard more than it becomes a help. So you want to make sure that whatever shoe you are wearing has some back, that your foot is in the shoe either through a back strap or an actual full shoe counter. Okay. So you want to make sure that you're not sliding, because when we wear slides, we curl our toes to keep our feet inside the shoe. And then that ends up becoming counterproductive, especially if they're not fitted properly. So whatever shoe you are wearing, you want to make sure that your foot is in there and supported with a back strap or a counter. You want to make sure that the front of the shoe, the toe box, is wide enough to accommodate all of your toes, that we're not taking round toes and putting them into pointy shoes. And we also want to make sure that that front of the shoe is high enough for if you have some issues with your toes where perhaps they're curled, or there's some, you might have hammer toes or some other deformities there that are not, I don't want to call them deformities, some other asymmetries there, so that you are accommodating. You don't want the joints in your feet to be rubbing up against the tops of your shoes. So you want to make sure the shoe is wide enough and also tall enough to accommodate the size of your toes and your feet.
And to add on to that, I would say that if you're someone who has bunions, if you're someone who has hammer toes, if you have more of a collapsed arch, those are things that really it would be helpful for you to have your foot assessed by a podiatrist, because, or a foot and ankle surgeon, only because getting the right adapted shoe, I think it really makes all the difference in the world. No one wants to spend all day in a tennis shoe except for me. I will do that. But one of the things that with most tennis shoes is that they are adaptable, they are adjustable, and so the footprint that you leave when you're barefoot and you see, that if your arch is collapsed, you need to support it. If your arch is really high and your toes are really curled, you need to have something that's going to support your foot, so that it's not a trip hazard. So the best thing I can tell you is to have if you want to go online and do a foot assessment, you can use Google and say, what's, how would I assess my type of shoe? There's a, I'm going to say roadrunnersports.com is an athletic shoe company. And one of the things that they do is they have what's called a shoe finder, and they will ask you the questions, that help you to choose a tennis shoe, for example. So there's plenty of brands out there that are very supportive. The hottest brand right now is Hoka's. Everybody's buying a Hoka shoe, and there's different reasons for Hoka's. But, again, one shoe does not fit every foot, in terms of functional purpose. So you have to really have it assessed.
Okay, next question. When do you know it's time to start using a cane?
If you are questioning that it's time to start using a cane, it's probably time to start using a cane. So don't think of a cane from a vanity perspective. Think of a cane as something that gives you that third leg of support. If you don't have good ankle flexibility, you are at a higher risk for falling. If you have bunions, you can be at a higher risk for falling. If you have peripheral neuropathy, where you can't feel the floor, you are at a higher risk for falling. So by having something that helps to steady you, it adds that additional point of support. So you can always start with something like a hiking pole, that just gives you a little extra support. I've had people who have turned a golf club into a cane. It's not recommended for everyone, but if you're starting to think that I'm getting off balance, if you find yourself catching your toes, that additional point of support, like a cane, is always a good point to start. And honestly, you may want to consider going to a physical therapist to have them look at your balance, because there's things that that a therapist can catch very easily. But it's never too soon to get that professional opinion.
Very good. Next question. Best exercises to strengthen the knee joint. One participant also has cerebral palsy and wants to work on mobility and strengthening.
I will take it if you'd like. So with cerebral palsy, the additional challenge is tone. It's an increase in tone, and so our patients who have cerebral palsy, as another component, stretching is just as important. Many times your functional movement, I started to go into my therapy speak, your gait is impacted sometimes with cerebral palsy. And so you can actually the steps that you take are not even size steps. But there's no reason why someone with cerebral palsy can't start a resistance training program. But it has to be under the supervision and guidance so that the movements that you're doing are safe, and the movements that you're doing, you're not over stressing certain joints that may, you can't just walk into a gym and start lifting weights. No one can do that safely. We want to make sure that you have the range of motion to be able to do things like lifting and resistance. And so I would recommend that a strengthening program can start with something like riding a bike. An elliptical machine is a great activity for people to start because it gives you the support to be able to start using your joints through your range of motion, a cycling range of motion along with a stepping range of motion, and you can add a little more resistance to that. But again, these are things under the supervision of a trainer or a therapist is always recommended. If you want to try things at home, just like we talked about, things that you use around your house, anything that challenges you is going to lead you to starting a weight or resistance program.
Okay, fifth question. Thoughts about knee braces and sleeves for painful knees?
I'll take this one. So as Dr. Ross demonstrated earlier, the neoprene brace for the hand, they make similar neoprene sleeves that just pull right up over the knee. Typically, there are for warmth and compression of a joint. They don't necessarily provide a lot of stability to a joint. And so if the purpose of wearing the brace, that warmth and compression helps relieve some symptoms as you're moving around, then there's some value in that. We want to be careful with saying that speaking in extremes, because there are a lot of different types of braces. So there are some braces that will provide more stability and accommodate for some changes in joints and some muscles that are weaker. So I don't necessarily want to say that all braces are good or all braces are bad, but if there's something such as a sleeve or pullover like the neoprene, those are usually good for warmth and compression. If you're considering anything sturdier than that, then you would probably want to be evaluated by your physician, your orthopedist, your rheumatologist, your physical therapist, that might be able to recommend the best brace for you. But whatever you are using, if you are using a neoprene sleeve, give your joints time to air out. Without the sleeve, you would certainly not want to sleep in it or wear it all the time. You want to allow for your body to accommodate at night, especially when you're lying down.
And the next question is for Dr. Ross. Exercises to correct ulnar drift in the hands?
Well, if the hand is beginning to go into ulnar drift, which means that the fingers are actually slanted this way, that is a sure sign that I think Dr. Kaplan mentioned it. You have a joint capsule because these are what we call synovial joints. And there's nothing that you can do to stop the deterioration of the joint. So the first thing that I'm going to say is that you probably are going to want to start thinking about positioning so that you can protect what you have. Typically, that may require a splint like this to be made. And the reason that I say this specifically is because it will position your hand. There are some very nifty splints that are on the market that you can they have like foam that go between the fingers. And you can probably get, honestly, an order for an evaluate and treat and then to be placed in something like that. And what it does is it starts the positioning. Now, the question was about how do you exercise that? So what happens is the hands, what we call abduct. That means the fingers are spread apart, and then they adduct, and then they come back together. And what's happening there is there's movement between the fingers and some muscles that start and stop in the hand. So if you start doing this, just kind of bringing the fingers together. And I would say do it on the flat surface of your table. So spread the joints and hold it for 5 seconds, and then bring the joints back. And then also look at trying to, again, straighten, because straightening is important, because usually what happens is the joint go into this posture. So also bringing the fingers into a straight position and then trying to bend them as far as you can. Again, I would advocate preparing the joint to do the exercise by warming the joints with a tolerable heat. And but other than that, I really think that if they're starting to drift, it's not just the ulnar drift at the MCPs. There's probably some changes also at the wrist, and that's the larger joint that you begin to rely on when you start to see the deterioration at your smaller joints.
Thank you. Okay. Question. Thoughts about music therapy and piano for hand maintenance and strengthening arthritic hands?
Well, not being a music major myself, I have had the opportunity to treat a number of people that enjoy playing piano. And I think that piano is an excellent exercise. Again, I'm going to say warm up the hands, everything in moderation. I would not advise, because I actually treated a lady who was a professor of music at one of the local universities, and she was really just doing a job on her hands. So I would say everything in moderation. I hear what these ladies say about the pain, the difference between pain in your muscles and pain in your joints. So I would say you have to be very, very careful with playing the piano, because there's not a lot of padding on your fingers, and that ivory board is kind of hard. So I would say use it, go very, very gently. The other thing, and I might toss this to Dr. Kaplan, but I know that with some of the string instruments, the posture and positioning needs to be addressed in terms of how people do things. And we didn't mention this, but this is so important. One of the things with arthritis that we have to realize is that we have to figure out how to do things differently. And I think there have been books that say it takes 21 days to make a habit. But the other thing with that is, and you don't have to do it all at once. Do it a little bit by little bit. Try some things differently, so you put your joints in a different position so that you can save them, because a lot of this is, especially with the osteoarthritis, wear and tear on the joint.
Okay. Suggestions about appropriate use of a rollator walker?
Did you want to take that, Dr. Kaplan?
Sure, I'll take that. So rollator walker, for those that may not be familiar, is a four-wheeled walker. So instead of having two wheels on the front and either skis or tennis balls on the back, it has four wheels. They also come in the three-wheeled sizes as well. The difference between a rollator and a traditional two-wheeled walker is it's built for speed. So the wheels are more mobile, so you can turn corners a little bit faster. So there are advantages to that because it provides enough stability, but the downside of that is because it is built for speed. If you are someone who needs something a little sturdier, and that walker has the potential to get away from you, and then that potentially becomes a little bit of a fall risk. So rollators work well for people who are beginning to notice they need a little bit of assistance, but they don't need as much stability as a two-wheeled walker provides with the tennis balls on the back. One of the advantages of a rollator, and something that I know a lot of folks like, is that it has the bench seat. So if you find that you fatigue very easily, that you get tired when you're out and about, what a lot of people appreciate about the rollator is that they can lock the brakes, make sure you lock the brakes, turn around, and then it's a seat for them. So perhaps if you have some cardiac issues or some pulmonary issues on top of your other arthritis issues, and you find that you don't have as much endurance and that you're limited, that rollator does provide a seat wherever you are for you to safely sit and take a break. Did you want to add anything in, Dr. Curry?
I was just going to add the inappropriate ways to use a rollator are to have somebody sit down on it and to push them as if they were in it on a stroller. I've seen, unfortunately, I've seen patients go over because the front wheels of a rollator swivel. And so if you hit a bump with that swivel wheel, the wheels turn and it will throw the patient off. So you should never have somebody sit on it facing you and pushing them on it. That's inappropriate. The second thing I would say is posture. We've talked a lot about posture, and posture is really important. So make sure that the handles of a rollator are high enough that someone can stand up. If someone has to bend over to use a rollator, then you're only facilitating bad posture. So it's always better to have the handles so that your elbows are bent about 30 degrees, because then you're going to be able to stand up further. If you've got to bend over, and lean on a rollator, then a rollator may not be the best device for you. You may need to switch to a two-wheel walker for a little bit more stability. So it's just something to think about in terms of safety.
Okay, and our last question is, what is the wand balancing exercise?
So yeah, thanks for that question. So when I speak about falls and fall risk and fall recovery, one of the things about preventing falling is how we change direction and move. So one of the ways that you can do that is if you take a broom, if you have a stick, for example, the more stable the stick is in your hand, the easier it is to control. So if you're holding the stick in the middle, it's much easier to control the stick. If you start holding the stick further on one end, then it becomes a little more unwieldy. So one of the exercises I do sometimes with people is I have them balance a stick. I'll have them start with it in the middle, and then I'll gradually move them to the end of the stick, and then I'll have them balance that on their hand. The reason I do this with people when we're talking about falls and balance is because I want people to dual task. I want them to focus on balancing the wand as opposed to where their feet are. And so then I start to work with them on being able to control that with balance. So in the grand scheme of exercise and in the grand scheme of movement, sometimes it's just adding in a task like that to challenge someone. And you can, as I said, you can always add in, you can always tape something a little heavier to that. There's so many different routes to challenge someone's balance, to challenge someone from an exercise standpoint. And I think all of us are just, passionate about ways to work with our patients to just, figure out how to challenge them the best. So, when I'm talking about, wand balancing, I'm talking about ways to challenge someone to move, to, switch direction, to turn, and to be focused on more than one thing at a time. So that's what a wand balancing exercise is.
Awesome. Well, that comes to the end of our questions. I want to thank all of you, all of our speakers tonight for lending their time. I think we, on behalf of our audience tonight, we're coming away with a lot of valuable information to keep our joints protected and limber. So thank you very much. And also I wanted to thank Robin Abery for being our host. She's kind of behind the scenes. And so we want to thank all of you and certainly our participants for spending some time with us, because, we're all kind of in this together. So the next thing we want to do, I think we promised that we would give you some resources. And so here we are. Before we sign off tonight, we just want to remind you of the several resources and events coming up. There are the Connect groups. There are the webinar arthritis, arthritis.org webinars. And you can see the dates when those are coming up. We mentioned earlier about the Walk with Ease program. So there is the information of where you can find that online. the Live Yes podcast, the helpline. If you have some questions that we're not able to answer because of time tonight, or if in the next few days or weeks you have questions that come up, you can always check out that helpline. There's the 800 number. The insights, I think we mentioned that earlier. I believe that's a survey that may come to you. Oh no, the survey is different than the insights. But anyways, you will probably be getting an email asking for a survey. And then the insights is more information. And let me see. I think that is all that we have for tonight. Thank you so much for attending, and we hope to see you again.